Hi, this is Jiske. This is a video for anyone working in Peds A&E, nurses, pediatricians, ED doctors. We would like to take you through the new setup in Peds A&E and through a sim of a deteriorating patient needing intubation. Streaming of patients happens at the door by medical students, and children and their one parent will go to either the non-respiratory side on the left or the respiratory sides of Peds A&E on the right. As you come into RESP PTD, the staff base is on the left, a temporary nurse assessment area on the right, and then a bay turned into waiting room. Old room 2 is now room 6, which is used for medical resuscitations, and if necessary, we can use room 7 as well. All pediatric major traumas are still to be run in Resus 4 in adult ED. In between room 6 and 7, there is a Resus trolley fully equipped for a pediatric resus with A, B, and C equipment in different sizes, depending on the size of the child. On the side of the trolley, there's a Resus folder with all pediatric APLS algorithms and also the trust guidance for resuscitation of pediatric patients with suspected COVID-19. You will also find the usual weight-based emergency charts. In our scenario, a child on Airway in room 6 deteriorates and needs intubation.
It's coming very blue. Can I get some help, please? Stay in the room. I'm coming down. Please, someone.
Can I have the paediatric team, please, to Children's A&E, respiratory side, level 1, room 6.
When people arrive after the 2222 call, the team leader allocates roles to most likely a first and second airway person, a nurse, and an ED or pediatric doctor. A max team of 5 put on full PPE. These 5 emergency PPE packs are stored in the linen cupboard. The door is locked, but the code is on the door next to it. Whilst the team is putting on PPE, a team of 3 outside runners in level 1 PPE can prepare the intubation trolley. One runner prepares an IV or IO access tray, another prepares RSI drugs and any further anticipated emergency drugs like adrenaline and fluid boluses. The pediatric RSI grab packs are in the fridge in Peds ED. A third runner prepares airway materials. What size airway devices and adjuncts you need depends on the age or the weight of the child. There is a poster on the wall guiding you what size of equipment to lay out on the airway trolley and in which drawer to find it. There's also a photo demonstrating this emergency intubation kit dump with a layout of materials that make sense to Team Airway. Claire will now show you how to set up the airway circuit for a small child and for a bigger child.
So for our COVID intubation setup, for the airway circuit, we need a face mask of appropriate size, HME filter of appropriate size, end-tidal CO2, inline suction of appropriate size, a cuffed tracheal tube, and an AIRS T-piece. To set this up, the first thing we're going to do is take this out of the bag. And this normally comes in a separate bag and needs to be put on the end. We're going to take the red cap off and that can be discarded. We're going to remove the angle piece for the time being, and we're going to connect first our end-tidal CO2. We then need to put the filter on, the inline suction, the angle piece, and then the mask. Once the patient is, and then this is what we'll use for pre-oxygenation prior to intubation. Once the patient is intubated, we'll need to remove the mask and the angle piece and then connect the inline suction directly onto the endotracheal tube.
For very small children, it may look like this. The small inline suction comes with a Y connector that attaches to the tube after taking off or cutting off the end of the tube, and the inline then attaches to the one end of the Y connector and the HME filter and the end-tidal and circuit to the other end.
So for bigger children who are using a water circuit, It's also in one of these bags, and this comes in a separate bag. You'll need to attach that to the end and take the cap off. We still need the same parts of the circuit, but for bigger children, the closed suction might have this double rim, so will fit directly onto the mask, which means as you connect your circuit up, you don't need the double angle piece, so you could remove that. But for smaller inline suction, you would connect your, as before, your end-tidal CO2 to the circuit, and then your filter, your suction, the angle piece, and then the mask. And again, you'd use this for pre-oxygenation, and once you've intubated, you would remove the mask and the green angle piece, and then pop this directly onto your endotracheal tube. If you're using the larger inline suction that fits directly onto the mask, you wouldn't have this there, it would be connected like that for pre-oxygenation, and then you would remove the mask and put that straight onto the endotracheal tube.
Remember, the airway material sequence is in alphabetic order: circuit, end-tidal, HME filter, inline suction, and then mask or tube. There is guidance for a Plan B or Plan C airway on the wall too, and LMAs and phonak kits in different sizes are also kept in the Resus trolley. Around the actual intubation of a potential COVID positive patient, a specific intubation checklist will be followed, part outside of the room and part inside the room.
If you have your face mask, inline suction, HME filter, capnography.
Yeah.
Okay, so that you will, when ready, remove the high flow nasal oxygen.
Okay.
Bagging circuit you're happy with, consider adrenaline and fluid bolus.
So can someone time, once the rock is in, we need 30 seconds.
Okay, I'll time. Okay.
Secure the ET tube, please. Always clamp ET tube before breaking the circuit.
Just to go around the tube. Just go around the tube. Okay. And as high up close to the patient as possible. Okay. So we'll be clamping there.
Okay. Then we'll turn the oxygen
Okay, that's clamped there.
This has its own end-tidal CO2, so we use it
So we need to keep that in.
Yeah.
Okay,
And that's gone. And we're going to unclamp now. So we've got a seal. And I'm just going to do that.
We aim to keep any used airway equipment with the patient in a closed bag. One more thing of note is communication. This is challenging whilst wearing PPE, so speak loudly. There is also a whiteboard in room 6 to scribe on. Finally, a note on crowd control. If you're not involved in the resus, kindly go back to staff base and resume your other jobs. The outside runners in level 1 PPE can stay nearby room 6 to help if needed. Although most equipment should be inside the room, the door must remain closed during the aerosol generating procedure. Thank you for watching, and if any questions, come and speak to one of our department.